Hello everyone! So for today's video, we're going to talk about cardiogenic shock. But before anything else, I am Hiltricia De Ramos from N3A, so let's get started.
Cardiogenic shock, or also known as cardiac shock, is a life-threatening condition in which your heart suddenly can pump enough blood and oxygen to meet your body's needs. The condition is most often caused by a severe heart attack, but not everyone who has heart attack has cardiogenic shock. It is considered a medical emergency and should be treated immediately.
For the table of contents, we will have 5 parts. First is the introduction of the disease. Second is the signs and symptoms. Third is causes of the disease. Fourth is the risk factors. And lastly, for the 5th part, for the prevention.
The heart pumps blood through the network of arteries and veins called the cardiovascular system. The heart has 4 chambers. The right atrium receives blood from the veins and pumps it to the right ventricle, while the right ventricle receives blood from the right atrium and pumps it to the lungs, where it is loaded with oxygen. Then the left atrium receives oxygenated blood from the lungs and pumps it to the left ventricle. The left ventricle, the strongest chamber, pumps oxygen-rich blood to the rest of the body. The left ventricle's vigorous contractions create our blood pressure. For brief history, the term shock was first used in year 1743 to describe a moribund condition after severe trauma. The description of cardiogenic shock in medical literature is a relatively recent occurrence.
So now we will move on for the signs and symptoms.
One of the signs and symptoms of cardiogenic shock, first, is rapid breathing or tachypnea, also severe shortness of breath. Sudden rapid heartbeat or tachycardia, having weak pulse, low blood pressure or hypotension, also sweating, cold hands or feet. In most cases, a lack of oxygen to your heart, usually from a heart attack, damages its main pumping chamber, which is the left ventricle. Without oxygen-rich blood flowing to that area of your heart, the heart muscle can weaken and go into cardiogenic shock. Rarely damage to your heart's right ventricle, which sends blood to your lungs to get oxygen.
Now, for the other possible causes of cardiogenic shock, it includes inflammation of the heart muscle or myocarditis, infection of the heart valves or endocarditis. Third is weakened heart from any cause. And lastly, drug overdose or poisoning with substance that affect the ability of the heart to pump. The development of cardiogenic shock increases after heart attack if you are old, female, being hypertensive and diabetic, having a history of heart attack and heart failure, and for those patients who are coronary artery disease.
The best way to prevent cardiogenic shock is to make lifestyle changes to keep your heart healthy and your blood pressure in check. Treatment aims to restore blood flow and protect organs from damage. Options include medicines, heart procedures and surgery, and medical devices. Some people may need a heart transplant or permanently implanted device to help maintain blood flow after cardiogenic shock. If it was caused by problems in the lungs or by medicine side effects, your doctor will treat those problems. If not treated quickly, cardiogenic shock can lead to life-threatening organ failure or brain injury. The first thing in the list on how to prevent this kind of disease is first, do not smoke and avoid secondhand smoke. If ever you smoke, the best way to reduce your heart attack risk is to quit. Maintain a healthy weight. Being overweight contributes to other risk factors for heart attack and cardiogenic shock, such as high blood pressure, cardiovascular disease, and diabetes. Losing just 10 pounds or 4.5 kilograms can lower blood pressure and improve cholesterol controls. Eat less cholesterol and saturated fat. Limiting these foods, especially saturated fat, can reduce your risk of heart disease and avoid trans fats. Also, decrease intake of salt. Too much salt or sodium leads to fluid buildup in the body, which can strain the heart. Aim for less than 2,300 milligrams a day of sodium. Salt can be found in many canned and processed goods, so it's a good idea to check food labels first. Cut back on sugar. This will help you avoid nutrient poor calories and help you maintain a healthy weight. Limit alcohol. If you choose to drink alcohol, do so in moderation. For healthy adults, that means up to 1 drink a week for women and up to 2 drinks a day for men. Having irregular exercise. Exercise can lower your blood pressure and improve the overall health of your blood vessels and heart. Get at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity a week, or a combination of moderate and vigorous activity. It's recommended to spread out this exercise during the course of a week. Greater amounts of exercise will provide even greater health benefits.
So that's all for today. Thank you for listening. I hope you enjoy and learn our topic about cardiogenic shock. So that's all. Thank you.